And welcome in. This is Healthy Living, presented by Care More Health Plan. Healthy Living, where we cover health topics for today's active adults, featuring some of the most renowned medical experts here in Las Vegas. Care More Health Plan with 3 locations across the Las Vegas Valley: 100 North Green Valley Parkway near the 215, 3085 East Flamingo near McLeod, and 2601 North Tenaya near Mountain View Hospital. Call 702-673-9060 or jump online to caremore.com. We're joined as always by Matt Engstrom, Regional Sales Manager for Care More Health Plan. Good morning, Matt.
What's happening? Good morning.
I see signs everywhere for you guys. You're moving now on Flamingo. I see a new sign down the road.
Yes, sir.
We'll talk about that later.
We are. I think before we get to our guests, we should maybe consider replicating what Robin Williams did with Good Morning Vietnam, because this is an early show, right?
Yes.
We need to wake folks up in the morning and maybe have a little bit louder.
If you want, I hope
we'll
Dr.
take it
Singh
off air,
doesn't
right?
get scared. But
yeah.
And joining us for the first time, Dr. Raj Singh, voted top nephrologist here in Nevada by HealthTap. Also voted top doctor in Nevada by Las Vegas Life magazine last year. Dr. Singh, a graduate of the University School of Medicine here in Las Vegas. Dr. Singh, thanks for being on the show.
Thank you for having me.
How long have you been in Las Vegas?
I did my residency here, so I spent about 3 years for my training, and then I've been in practice here for the last 4 years.
Ah, excellent. And where did you grow up?
So initial part of my schooling, everything was in India.
Oh, okay. Wow.
Yeah.
How long did you live there?
So I would say till I was about 21.
Oh, wow.
Yeah, then moved to the United States to pursue higher education, and of course I got accepted at the School of Medicine here, did my training, then moved to University of Kansas, so spent 2 years there for getting training for nephrology, which is a specialty that currently I practice. And then I love Las Vegas, and I'm grateful to the School of Medicine, So,
all right.
So came here, and I've been practicing here since, and love my job.
Tell our listeners about India. I've never been.
It's a fabulous country. We have a lot of regional languages. It's very secular, multiple religions. And I grew up on the northern India, which is a province called Punjab.
Uh-huh.
Okay.
Yeah, so it's a fabulous country. You should go there sometime.
All right.
Especially in winter, less mosquitoes.
It's on my list. So I imagine Las Vegas has more to offer than Lawrence, Kansas.
Absolutely. It was actually Kansas City, Kansas. That's where our hospital was.
Oh, you were in KC?
Yes, so it was a very good hospital and very good university. I think we got excellent training there.
I'm very familiar with that part of the country.
Doctor, I'm fascinated by your field. I mean, we hear about our kidneys all the time, but I think many of us don't know or don't pay attention. So if we could, let's start with what our kidneys are and what they do for us.
Absolutely. So the kidneys is, they work a lot. We all have them, 2 of them. But they rarely cause symptoms. So most of patients are never concerned about their kidneys. But kidneys are these bean-shaped organs. They are the size of our fist, and they are in our back.
They're that small?
They are that small.
The pictures we see, I would think it would be, big, almost like a whoopee cushion or a water balloon, like a football size. Not that big?
Sure. No, they're not that big. They're the size of our fist, but they do a lot of work. So...
And what is their primary function for us that aren't that educated?
The kidneys, they have actually multiple functions. Mm-hmm. And one of the important ones is regulation of blood pressure. So then, of course, they regulate all the electrolytes, calcium, magnesium, potassium. We're drinking all this stuff.
Mm-hmm.
And they regulate fluid balance so that we drink could drink several gallons of water but not get swollen up. That's the job of the kidneys. They make a certain hormones. They regulate our vitamin D, remove all the toxins. So if you ingest a poison, it has to be removed, and that's the job of the kidneys.
Right.
Any excessive medication, all the toxins. So they're basically kind of working like filters for the body and are removing the things from our body that are not needed.
Interesting, Doctor. We hear about our blood pressure, and we think it all has to do with our hearts. You're saying the kidneys play into blood pressure somehow?
The kidneys actually regulate blood pressure.
No kidding.
Mm-hmm. The kidneys sense the blood pressure, and in order to maintain filtration, they release certain hormones, which actually tell the rest of the body what the blood pressure should be. So the heart does not have a main role in regulation of blood pressure. It's just a pump. But how strongly that pump should work and everything else is regulated by the kidneys.
So someone with high blood pressure has kidney problems.
Not necessarily. Initially, if you have high blood pressure, it takes several years for the kidney damage to occur. But once the kidneys get damaged, they are having a difficult time getting blood filtered, so they release a lot of hormones. So the patients who have kidney disease tend to have much higher blood pressures, and the blood pressures are difficult to control.
Got it.
So is it safe to say that all patients with kidney disease have blood pressure issues, but not all patients that have blood pressure have kidney problems?
Absolutely, that is correct.
And how do you test our kidneys?
So the kidneys, as I said, they don't cause any symptoms in the early stages. So most patients have very advanced kidney disease and don't realize that their kidneys are not working too well. When the kidney function falls to less than 15%, only when you can experience some symptoms such as swelling of the feet and maybe some itching, some nausea. But most of the time, the patients we see have virtually no symptoms. So they're in a shock when we tell them that the kidneys are working maybe 20%, 30%, and they don't believe us. But the kidney disease can be tested. It's very simple. We can do a routine blood test. It's called creatinine. And most of the primary care doctor offices, they will check the labs for kidney function, and that's how we get our referrals. And then there is a urine examination, and if the urine has a lot of protein or a lot of blood, that's usually a sign of kidney disease as well.
At what age should people start testing their kidneys?
I would say if someone has diabetes, they need to see their doctor every year, and the kidney function should be checked because diabetes is one of the number one reasons why patients have kidney disease. So diabetes and high blood pressure lead the way for most of the kidney disease, and our estimates are about 23 million Americans have kidney disease. So it's a lot of patients. So yes, so you need to see a doctor. If you have diabetes, of course, you need to see a doctor every year. And if you have very severe diabetes or diabetes of several years of duration, of course, you need to see your physician much more regularly and get checked for your kidneys.
Our guest, Dr. Raj Singh from Kidney Specialists of Southern Nevada. If I could, I'd like to go back. What about age variations? Have you seen children with kidney problems or teenagers?
Absolutely. I mean, the children can have kidney problems. You could be born with one kidney, or the other kidney could not have developed properly. There are infections in the kids, but we primarily here deal with the adult population. So I don't consider myself an expert on kidney disease in the children, but yes, it is there.
Yeah, I remember my family had to have his kidney removed when he was 2. Okay. It's a big deal at that time.
Sure. And nowadays, since we're seeing type 1 diabetes at such a younger age with obesity on the rise, so more and more kids actually have kidney disease because they're just getting onset of diabetes pretty early.
In your practice, doctor, what are the top 3 kidney problems you see here in Las Vegas?
I mean, as the biggest cause of the kidney disease is diabetes, high blood pressure. Those are the 2 big ones. And then the remaining ones is something we call glomerulonephritis. It's a big word, but it means inflammation in the kidneys. And that can be from autoimmune diseases like lupus. The other big one we see a lot these days is patients who are taking unnecessary over-the-counter medications like, ibuprofen, Advil, Aleve. So they think it's over-the-counter, so it does not cause any kidney problems, but we consider them kidney killers pretty much.
No kidding. Why?
So the kidneys, in order for them to work properly, they need to regulate their blood supply. So these medications, they interfere with how the kidneys regulate blood flow. So when you take a ibuprofen or a Advil or Aleve, you're pretty much decreasing the blood through the kidneys by about 20-30% right away. So if someone is taking that regularly, let's say every day for a couple of months, your kidneys will be irreversibly scarred. So that's one of the common preventable things we see, and it's really sad.
So, Doc, you mentioned that generally the kidneys are not going to display symptoms. I can recall back in my college days, before we go to practice, if I had an injury or a problem, it wasn't uncommon for me to take a couple, 2 or 3 leave. And I remember on a handful of occasions, I could feel this sort of a dull pain. Would that be a placebo effect, or was it possible my kidneys were saying, hey, man, that's too much?
It's unlikely. The kidneys, as I said, rarely cause pain, and the only time you can experience pain in your kidneys is if there's a big kidney stone blocking the flow of urine, or if there is a infarction, which means there is an interruption in the blood supply to the kidneys. Otherwise, the kidney disease is rare. Sometimes you can have infection of the kidney, and we call it pyelonephritis. But in that case, you will also have fever and chills and other symptoms of a urine infection. But the pain in the kidney disease is uncommon.
Probably in my head then.
And I don't think that taking the 2-3 Aleve probably caused anything.
Fair enough.
It's more for taking it regularly and for longer periods of time.
Right.
The painkillers are a biggie out in our town, Doctor. We're a 24-hour town. We're a casino town. Many people just have aches and pains from jobs or standing. So if we're taking painkillers over the counter, we better be seeing a doctor and disclose, no?
Absolutely. If you're taking a lot of over-the-counter pain medication, you need to be careful what you're exactly taking and if it's safe for you. And as I said, because they are over-the-counter, most patients feel that you can take unlimited number of them and without having any problems. And to give you an example, like Tylenol or acetaminophen, common medication for a headache, is one of the big reasons for getting liver transplants in the United States because it causes so much toxicity. And we think it's over-the-counter, so it's no big deal. And Tylenol itself is toxic to the kidney. So taking occasional doses here and there is no big deal. But if someone has diabetes, they have high blood pressure, some kidney disease, and on top of that you're taking this medication, you probably will be on dialysis a few years down the road, which is a replacement therapy for the kidneys.
I guarantee, Doctor, there are hundreds of people with their mouths open right now reacting to what you just said. What about a maximum amount, if you could? If people take these over-the-counter ibuprofen, how many per month or per week should we stop?
So what I tell my patients is to start with the lowest possible dose. So for example, ibuprofen, which is 200 milligrams, is the starting dose. So try if that helps your pain and takes it away instead of going for grabbing a Aleve or Advil extra strength, because more extra it is, more toxic
They
it
got
is.
the Bayer at 500 milligrams, Doctor. That's the ones that I use.
Yeah, so I would suggest that I recommend starting with a lower possible dose and take it occasionally. If you have a lot of pain, we need to figure out why you have pain. So that should be the first thing instead of popping a pill every time you have a headache or a back pain. So it's more important to figure out the cause of pain.
What if it was a loud casino for 8 hours and it's ringing in my head? I guarantee you
Maybe
there's
you should
hundreds
go
of
to bed.
people saying that.
I'm sure being in the casino and all that smoke environment itself is bad. But there are safer pain medications that can be used. I'm not a pain specialist, but my patients who have a lot of chronic pain and we want them not to take over-the-counter pain medication, we refer them to pain specialists. And we kind of work with them so we can devise a proper pain plan so that our patients are not in discomfort, but at the same time are not getting their kidneys hurt.
So one of the things that I've seen in the last 10 years in this business is a huge increase in the number of opiates that are being prescribed to patients. I have to assume that if over-the-counter medications have an adverse effect on the kidneys, that these opiate and opioid medications would.
Most of the opiates are metabolized by the liver.
Really?
So they are not really toxic to the kidney, but taking a lot of these medication, for example, someone is taking a lot of Percocet or OxyContin, these drugs, because they are removed, their metabolites or their end products are removed by the kidneys. So if someone is taking a lot of these, you can develop toxicity. And we have seen patients dying because they had a respiratory arrest, they had kidney disease, they were taking too many of these narcotics who were gradually got built up in the system. So although they're broken down by the liver, but they are still removed by the kidneys.
So it's still an issue, but not so much when you get down to nephrology.
Toxic. Yeah, it's not directly toxic to the kidney, let's put it that way.
I wouldn't have thought that.
Yeah.
So basic biology, if we could, Doctor. Our kidneys cleanse our blood, produce urine. What does the liver do?
So the liver has multiple functions. So the liver is making cholesterol, it's breaking down protein, and it's also metabolizing a lot of the drugs that we take.
This will be on your test for our listeners.
Well, this is big because I think people get confused. They say, if I drink too much, I'm going to damage my liver. But can't we damage our kidneys too?
Yes. If you're drinking too much alcohol, of course, it's metabolized by the liver, so you'll develop liver toxicity and the liver won't like it. But again, taking too much Tylenol, focusing back on the over-the-counter medications are really bad. And I will add all these herbs and supplements that patients are taking as well to that list.
Can you test the liver?
Absolutely. The liver can be tested, basic liver enzymes. So that can be done in the primary care doctor's office, and we can tell how the liver is doing.
Same thing, blood test?
Blood test.
Okay.
So, Doc, I'm curious. how did you end up in this specialty?
So we all get to choose what specialty we
Right.
want to do. So I always was a big fan of organic chemistry and physiology, loved the acids, electrolytes. So during my training years, one of the nephrologists from this practice, who was also my mentor at that time, and he kind of said, well, you are really good at this stuff and you should consider becoming a kidney specialist. And so I had
Okay.
very good teachers at the School of Medicine, and I had good mentors, and that's how I ended up here.
Every time we talk to a physician, I always want to ask, how and why did you pick this particular specialty versus
Yeah,
the others?
You couldn't go for the liver. You had to go for the kidneys.
right?
And I mean, as you could tell, I get excited every time we start talking about the kidneys, so that's the reason I'm here. I like talking about kidneys, and you know.
Well, it's got to be a really cool feeling to know how all this stuff works and to know it in such a way that you can just regurgitate it in a way that we understand and the public understands.
Sure.
That's got to be a cool feeling.
Absolutely. And it was one of the complexity of the kidneys and the functions they do, I think, that kind of drove me into this field and kind of learning more about the kidneys.
Gotcha. Our guest, Dr. Raj Singh, have so many questions for you, Doctor. Want to talk about kidney stones, want to talk about urination, dialysis. We'll take a break, come back with more as Healthy Living continues.
Medicare questions, CareMore has answers. We have operators standing by to answer your Medicare-related questions and to discuss the variety of CareMore health plans to fit your needs. If you're on Medicare or know someone on Medicare, call CareMore at 877-211-6614 today. That's 877-211-6614, 7 days a week, 8 a.m. to 8 p.m., or visit us at caremore.com. CareMore Health Plan is an HMO SNP plan with Medicare. Contract enrollment in CareMore Health Plan depends on contract renewal.